College of Wisconsin's Coffee Conversations with Scientists. Since early 2021, we've been sharing the science behind today's most important health topics. Coffee Conversations is brought to you by the Advancing a Healthier Wisconsin Endowment, a statewide nonprofit working to improve health and advance health equity in Wisconsin. I'm Dr. Michael Zimmerman, Director of the Bioinformatics Research and Development Lab at MCW's Mellows Genomics Center for Genomic Sciences and Precision Medicine Center. I'm Assistant Professor of Bioinformatics at our Clinical and Translational Sciences Institute and the Department of Biochemistry at the Medical College of Wisconsin. Today, I'm joined by Jenny Geurts. Ms. Geurts is an Assistant Professor in the Institute for Health and Equity at the Medical College of Wisconsin. She is also a clinical genetics counselor and currently serves as the inaugural program director for the Master of Science in Genetic Counseling training program at MCW. Ms. Geurts has been in practice for over 15 years and has specialized in a variety of genetic conditions, including oncology, cardiology, neurology, gastroenterology, and endocrinology. She most recently has provided clinical care with an emphasis in the inherited cancer conditions at Frederick Medical College Clinical Cancer Center. And she's board certified by the American Board of Genetic Counseling. Welcome, Jenny.
Thank you, Dr. Zimmerman. It's great to be here.
We'll be covering a great list of questions regarding the science behind genetic counseling and genetic testing. Certainly, genetics is important to health and healthcare, yet it is one of the multiple factors in healthcare. Being newer to healthcare, it's less familiar to many people, which is why we want to talk about it today. Genetic testing, being such a broad topic, will not be able to address its many facets. Suffice to say, researchers and providers, including us and those around the world, are working to incorporate more precise information for each patient to tailor your care. I encourage all of you watching to drop any questions you have into the topic into the comments. We'll be getting to as many of those as possible today. We'll start with a focus on learning about the process of genetic testing and family health history. So let's get started. Jenny, could you tell us all, what is genetic counseling?
That's a great place to start. Genetic counseling, defined as the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. So this process is integrating, interpreting family and medical histories to assess the chance that a disease might occur or recur. It involves education about the inheritance, testing, management, prevention, resources, and research. And it's counseling to promote informed choices and adaptation to the risk or condition. So when I heard the title of today's topic, I thought the science behind it. The science is the basic science, what we know about genetics and testing and all the great technologies that are coming at hand. And then also the social science, the people, how we understand risk. What does it mean for our family? So it's the combination of both those two.
I think it's a great combination. So in order to do genetic counseling, of course, we have to have something to talk about. So could you tell us, what is genetic testing?
Yeah, so we like to distinguish those two things, counseling from the testing, because the counseling is the appointment, it's the conversation, it's getting the information. The testing is the actual action of doing a DNA test. So it's a process where we analyze DNA, your inherited genetic material, and there are thousands of types of genetic tests that can be done on various samples. We mostly use blood or a saliva sample.
And, a quick note on that, even, different tests can, of course, be analyzed in different ways. And again, we don't have time to get in all the facets that there is. We just want to put a little plug for that side of things too. Jenny, what are the benefits to patients and individuals for genetic testing?
Thanks for that question. A lot of people ask when they're referred, why do I have to go to this appointment? What's the purpose of the test? So really what we're trying to do is a few things. One is provide risk information for individuals and families. Am I at a higher risk to develop this condition? And that may be useful for family planning or health and lifestyle decision-making. But also the second big piece of this is providing information that's useful for medical management. So individuals, doctors, or care teams may want to know the results of a genetic test because it may offer options to prevent or early detect or find a more effective treatment against different types of conditions that could have an inherited component. And in some cases, the testing actually helps relieve anxiety or end uncertainty with the patient and what they've known about their family history.
So I want to follow up on what you just said there about uncertainty. So on one hand, we all seek certainty, especially in healthcare. We want to know what's going on and what do we do about it. Yet the genome is a big place that we continue to explore. In genetic counseling, how do you balance communication about uncertainty versus uncertainty? Certainty versus uncertainty.
Yes, that's a big question. So we talk about genetic tests in the terms of, we cannot predict the future. It's not a crystal ball, so to speak. In many cases, we're merely assessing and saying that the risk for developing the condition is increased, but it's not guaranteed. And a common example we talk about is with the breast cancer genes, BRCA1 and 2, and the risk for developing breast cancer, where someone may carry a change in that gene that increases their risk for cancer, but it's not a guarantee that they would develop the condition. And in other cases, the genetic test is more diagnostic, and it tells us the person definitely has the condition, such as testing for something like Down syndrome. But even in that case, we can't accurately predict how severe someone might be affected. So in that case, we encourage, expecting parents who might be finding out that their child has Down syndrome to join support groups and get involved with Down syndrome associations so that they can have more exposure to people with the condition and see the wide range of abilities and achievements seen in people with Down syndrome.
So again, knowing that the genome is a big place and that there's different, kind of known drivers for the ones that we know about, and there's, other regions that we don't yet know how to interpret medically. It's clear there are different kinds of genetic testing. Could you give a little more of a definition of those different types of genetic tests?
Yeah, we can dive in on that a little bit more because I said there's thousands, but I can generalize and categorize them in a bit. So in genetic counseling and what we're talking about today, what we mainly focus on is something called germline clinical genetic testing. So germline is just a technical word that refers to the DNA you inherited from your parents. And the clinical part, meaning the results of the tests may be used by your healthcare team to guide your medical management, that the results could have implications for your health. So non-clinical germline genetic testing would be things like ancestry testing. So still looking at the DNA from your parents that you were born with, but it's more for a recreational use. It doesn't have implications for your health necessarily. Other types of clinical genetic testing may include tumor testing, where we're actually looking at the DNA from the tumor or a cancer, where again, that's not necessarily the DNA that you inherited from your parents. Tumors actually acquire mutations over time in the process of becoming cancer. And so these types of tumor tests, where we're analyzing that tumor tissue, may also be referred to as molecular profiling, somatic testing, or by some other trade names. Some of you may have heard of them if you know or have been affected by cancer. These tests are often ordered by an oncologist to the cancer doctor to determine the best course of treatment for the tumor. And they typically do not involve inherited risk, although they can. And it's usually, again, a separate test from the types of tests that we're offering in clinic, which is, again, it's a blood or saliva sample that's looking at the DNA that you were inherited with. And then I'll mention one other broad type of genetic testing that's clinical as well as prenatal testing, where a pregnant person is having a screening test to evaluate the health of the baby. So we're involved in a lot of different specialties. And as I mentioned, there's thousands of different genetic tests. And that's why I feel our jobs are so important, is to help educate, the patients, the public, and the care teams on what test is most appropriate for this patient's specific situation.
You said it, but just so it's clear to our audience, with something like a cancer where there's a tumor that's developed changes over time, we don't know what those are without some ability to sample that tissue. And sometimes the most direct is to have a biopsy or a piece of that tissue itself, which of course for some diseases is difficult to get to. So it's, again, like you said, a conversation with the care team about what the right action is. So for those listening, How would they go about getting genetic testing done?
Well, yes. So I will say clinical genetic testing, so one that has impact for your care, your healthcare, should be done through a healthcare provider's office. Typically a primary care doctor will refer patients who have certain red flags for hereditary conditions to a genetic counselor. So they'll review that personal and family history and have a discussion about the genetic testing available. Then based on that conversation and the patient's decision making, the genetic counselor will typically order the test that was discussed that the patient decided on, and then provide interpretation of the test results back to the patient and their primary care doctor or whoever referred them for the follow-up and the medical management recommendations. So with more genetic counseling services being available through virtual visits now since the pandemic, what we're trying to do is create easier access for people to receive genetic consultations. And then in most cases, actually, even with the pandemic, what we did is we just shipped a collection tube to their house, a saliva collection tube, where they just spit in a tube and then they can mail that off after their virtual visit's done. And we get the sample in the lab and it's all in a prepaid envelope and make it as easy as possible for them. And then we can call them for a virtual health results follow-up appointment as well. So we're trying to streamline that access to get the genetic testing done and make it easier for people, either through virtual visits or in-person visits, but again, typically referred by their doctor or primary care team member. So that's for the clinical testing when it's has implications for their health. But the new area that we're seeing a lot of advertised online is the recreational genetic testing that I had mentioned earlier, or something called direct-to-consumer genetic testing. It's kind of like an over-the-counter type of test. And so that testing is available without a provider's order. And it's something that consumers usually access online through the different companies that offer it, just right on their website. They put in their credit card information and the testing company mails them a kit. And they, again, similar collection idea where they spit in the tube and then mail it back. That information is not reviewed by a doctor or a healthcare provider. It's not part of their medical record. And we typically are not using that in healthcare decision making. So that's that kind of receiving those results and ordering the test is all directly through that company, through that website. The healthcare team's typically not involved in that.
I appreciate that. And for the viewers, are there actually benefits to those over-the-counter tests? You mentioned they don't go into the medical decision making. It's a different rigor that's done for those. But are there benefits to those?
Oh, this is such a loaded question. So I think the potential is great. And I think, there are some technologies that are getting there, but health benefits, not typically. I think it's subject to interpretation, right? So if you did a recreational test that supposedly evaluated your athletic potential, and based on the results of that test you did online, you decided to exercise more and eat healthier, then yes, that's a benefit. But I'm guessing your doctor was already making that recommendation. So I think it's really more of, the benefits being if the results of the recreational tests are motivating behavior and lifestyle changes. And then the other benefits could be like connecting with family members, because a lot of these ancestry tests, you can discover family relations and discovering more about your ancestral background, which can be fun. And I also just want to say there's a little bit of a buyer beware message I want to send here. That is, there are many people who have jumped into this recreational testing thinking it was just for fun, but then discovered something potentially very damaging about their family, such as the brother they didn't know they had. Yeah, surprising. Like family relationships can be complicated, or maybe someone was adopted and they were never told. So these recreational tests really have the potential to uncover family secrets, which can be difficult to deal with. So imagine, being gifted a test from your mother to find out about your ancestry, and that test really revealed you had a brother you didn't know about. That becomes quite an interesting gift and a conversation now to have with your family. So again, buyer beware.
Indeed, indeed. So all of these, the theme here is around, genetic testing, genetic counseling, and its relationship with family history. So could you tell about how family history relates to genetic testing?
Yes. So family history. So ideally, we have both pieces of information. We have genetic testing information that tells us about the DNA and the person's makeup, but then also family history, because the genetic test is not the end all be all. It can't tell us everything. The family history is how it's played out over generations. How has this genetic predisposition shown in someone's individual family? And we really want to interpret those together to fully understand a person's risk for developing the condition. However, many people don't have a complete family history available to them.
Mhm.
They just don't know. So we work with what we've got.
Something I want to add to that too, and get your comment about is often a negative family history is itself a really important part of the puzzle, piece of the puzzle. So, many conditions, many people with, so in our work, as we focus on rare diseases, which collectively are quite common, but each of them individually affects a smaller number of people. Um, and there, many of the genetic changes were not inherited. They were de novo, is the jargon term, right? They came in the embryo itself and didn't come from mom or dad. And so maybe comment a little bit on that, Jenny, about negative family history.
Yes. So being able to rule things out in the family. And when we say, well, we looked back at this family history and we didn't see, any history of X, Y, or Z, it can help us understand potential inheritance patterns, which you're referring to, this de novo, meaning brand new, something
Mhm.
that's brand new in an individual, having a child that's affected with a condition. And you look back at the family history and say, there was no warning of this. There was nothing that we saw. And that's part of the genetic counselor's evaluation. Could this be a recessive condition where mom and dad were carriers but didn't display any symptoms themselves?
Mhm.
Or could this be what you were speaking of, de novo, something that's brand new that happened, a genetic mutation that happened in the embryo that wasn't going back generations? So yeah, there's a lot to discover. I kind of compare it to an investigation like Sherlock Holmes, trying to
Yeah,
uncover clues. And the family history can sometimes give us clues, but sometimes not.
absolutely. And in some ways, it is a little bit of a loose, for some conditions, a kind of a loose proxy for a genetic, how is this coming through the genetics of the family? One other buyer beware point as the data science bioinformatics side of things is these companies, not it is what it is, but they're not thinking about medical data privacy, and that's just another buyer beware sort of note for our viewers.
Yes, I
Jenny, with
always tell people
Thanksgiving,
to read the consent form, read the 17-page consent form that's in 5-point font.
yeah, before you say yes, 499 is fine.
Yeah.
With Thanksgiving coming up, what are some of the conversations that you would say our viewers could have with family about health history?
Yeah, I was really happy about the timing of today's program because Thanksgiving's coming up and we're looking forward to spending time with family and eating too much and all that great stuff. Um, there are some really great resources we'd like to provide everyone to help them collect family history information. We're going to put those in the chat. It's really important to collect and document this information in an organized way. These are oral stories that go back generations and they can be forgotten or details misremembered. And often when the keeper of this information passes away, that information's gone permanently, unfortunately. So starting to write things down, talking with the elders in your family, the keepers of the family history knowledge, asking questions, and then again, organizing those responses. So Thanksgiving is National Family History Day here in the United
Hmm.
States. So it's a great opportunity to connect with some relatives. Maybe you don't see that often and start asking some of these questions about their health history. It's relevant to ask about things like what type of health issues people have had, such as cancer and heart disease or neurologic conditions, which all can have a hereditary component. And then also to document if there's any specific diagnoses, specific conditions, and what age also were people first diagnosed with the condition. Because in general, when we see conditions that are diagnosed at a younger age, we have a higher suspicion that that could be something inherited. So, for example, knowing that an uncle had colon cancer in his 30s, when most colon cancer is diagnosed in people after 60 years of age, that's something you'd want to report back to your primary care doctor. And you can write down all of that information and provide it to your care team at your next healthcare visit, or send it in a MyChart message. And I think sometimes it's hard for folks to initiate these conversations with their family members, particularly if your family isn't maybe one that has shared a lot in the past. So maybe starting with your why, starting with the fact that maybe you saw this program and it got you thinking about what conditions you might be at risk for, or your children. And starting with a real heartfelt why, that we know now more about genetics, we know more about how to prevent and detect conditions early. So that example with the uncle with the colon cancer in his 30s. Well, if you could start colonoscopies early, we could potentially prevent the colon cancer from happening again in a family member. So really explaining, why we're asking these questions. We're not just asking to be nosy, we're asking because it could save someone's life.
Absolutely. We've actually had a couple of really great questions come through in the live stream here. So let's
Let's
turn to
jump
a
to
couple
it.
of those quick from our
Yeah,
viewers.
great.
So this is a wonderful question. How relevant is a mother's breast cancer diagnosis to potential health risks of her male child and future offspring?
Oh, I love that this question was asked.
Yeah.
So this is a common misconception I get in the cancer genetics clinic, and it's, both public and even care providers get confused on this. So whether we're talking about genes for breast cancer or ovarian cancer or other, organs, female organs, the genes that we have that increase risk for those cancers are carried on the same chromosomes in men and women. So it's not one of those things where you might hear people say, oh, it's only in men or it's only in women. Genetically, we call that a sex-linked trait or X-linked trait. That's not the case for cancer. Those cancer genes are on the chromosomes that we share, both men and women. And it's not that there's just one cancer gene for breast cancer and then a different cancer gene for prostate cancer, let's say in men. Those genes all share cancer risk. So my example that I shared earlier of BRCA1 and BRCA2, those genes were first discovered in women that had a strong family history of breast cancer. And so they're named breast cancer 1, breast cancer 2. But then they started to appreciate there's risk for male breast cancer. There's risk for women to get ovarian cancer. There's also risk for pancreas cancer, which can be seen in men or women. Yeah. And other types of cancers as well. So that, whether it's, having male or female descendants, it's information that should be shared broadly with all family members.
And just a small add to that, which is that these, as Mr. just said, this is named breast cancer associated gene 1. But what is it? It's a little molecular machine that is necessary for your cells to be viable cells. It's a little nano machine that's, again, all of your cells need. And if it stops working right, it can affect any tissue of the body.
Yes.
Another, actually quite deep question from the audience. How do you believe gene editing, or to remove a mutation from a fetus such as Down syndrome or a rare inherited genetic condition, will be widely available and affordable in the future? And follow-up question, any thoughts on the ethics of this? So again, there's a number of facets to this. I'd be happy to add, but Jenny, please.
Yeah, so gene editing is challenging. And so the very informed question writer here, because we think about how do we do gene therapy for certain conditions, like, for example, ocular conditions in the eye. Well, if you can edit the different cells and the genes in the eye, you might be able to bring back someone's vision, for example. But doing gene editing on an embryo, that's where things really get dicey, because we really don't understand the potential consequences of making that change in something that's just starting to develop. And this is where, Dr. Zimmerman's very knowledgeable around epigenetics and all these other pieces of the play. When you start messing with things at that phase, we really just don't know what the downstream effects are. So that's where that ethics piece comes in. And there's a couple of different ethical points you can make around this. But that's why a lot of this work right now is strictly reserved in animal modeling or other cell culture work, where they can explore these in a controlled laboratory setting, not on humans, and really be able to thoroughly evaluate the potential consequences and potential benefits of that sort of work. And that work will take decades. So just because we have the technology to do it A, doesn't mean we should do it, and B, doesn't mean we should implement it right away. We have to spend a lot of time thinking not only about the scientific implications, but also the ethical implications. And I feel like we could have a whole session on this topic. What are your thoughts, Dr. Zimmerman?
Yeah, yeah. No, it's again, I love that someone asked the question because it is an important one, and it's one that I've had audience members ask in talks for over a decade now. So I think it's on people's minds clearly. Can we fix this? I would want to add a couple of things, if we have time here, which is the difference between gene editing and gene therapy. So, for example, right now, there's a number of people who are born with, they're called storage disorders, different kinds of storage disorders. Basically, your all the cells in your body have to take out the trash. And if they can't do that, if the garbage disposal gets clogged, so to say, or the conveyor belt stops, things pile up. And when a little bit of a mess, a pile up isn't too much of a problem. But over years of accumulation, they get so much junk laying or junk. It's not junk. It doesn't have current use, right? You get a backlog built up, and it gets in the way of everything else the cell has to do because there's just too much stuff laying around. So these are kind of storage disorders. You overstore in your cells. So if you can, give a shot or a pill that can replace the machine that clears that stuff out, you can treat, without editing the genome. And so there's a number of things like that where a genetic therapy or some kind of something in this direction might be a lot more feasible, because you're not changing how the system works. You're not changing the blueprint of the body, so to say. The other thing is the technical piece of if you have a single, like if you do in vitro fertilization, you have a single embryonic cell, maybe editing that is feasible. But as soon as you have a multi-cell organism, it's hard to get every cell uniformly edited. Like right now, there's some real, we can do it in cells and in animals, but there's some real technical challenges to doing this, outside of a single cell stage. Again, I think our viewers are interested in this. So I'll say there have been a couple of high profile in the news cases where people did this in humans. And the result was a person who's mosaic. So getting what I mean by this is just like a mosaic, a tile mosaic, where you have many different colors, many different aspects. Many cells in their body have a different genome. So when Jenny said that we don't know exactly what's going to happen, when people tried doing this, multiple events happened, multiple genome editing events happened, and different cells in these children's bodies carry slightly different genomes. And we have no idea what that's going to mean for them developmentally. So there are some of the knowns that we know what the risks are. Here, this is an area where there's a lot of unknowns. So it's, again, like Jenny brought up too, there's a lot of uncertainty associated with some of what we find, and there's uncertainty with what would happen when we apply some of these techniques in people.
And importantly, the international scientific community really having some pretty strict opinions about not entering this sort of work, and condoning those sort of human types of experiments. Unfortunately, some people may go out on their own and do something like that, but not in the United States, and certainly the international scientific community.
And even
has made a stand.
In the countries where this happened, the individuals, I think
consequences.
Yeah. That's a good way to say it. So I think in the interest of time, Jenny, any last words about family history, genetic testing, and what our viewers could do to perhaps in the coming months, to have that dialogue with their family?
Yeah, well, I feel like we're just scratching the surface. So I have a couple of thoughts. One is, if you're interested in hearing more about this and your questions didn't get answered, we're always looking for new topics to explore. So maybe we have to do a part B or offshoot of this. We'd love to do that. And then the second part, just regarding the kind of action to take moving forward. Again, thinking about being curious, having those conversations with family members, and thinking about how, the past does not have to repeat itself. So if you do have a strong family history of cancer, let's say, that doesn't mean that you're destined to get cancer. It means that we should probably figure out what's going on, and we should explore that a little bit further. And maybe through genetic testing and family history analysis, we determine we can take some action so that history doesn't repeat itself. So try to empower yourself with this information. The information can be incredibly valuable. We just have to make sure we're getting accurate information from family members through ordering appropriate genetic testing, and then really working with your care management team to develop those specific things that we can do to prevent diseases from happening in the future.
Absolutely. And one last note, if you don't mind, something that I think is very important about the area of genetic testing, and without getting into details, is that there's an enduring value to the genetic information. And what I mean by that, it's that there's a certain amount that we know now, and that's very useful, as Ms. Geurts has articulated well. But in 5 years and 10 years, we're going to know more than we know now. And so coming back to the question of, well, is there any update to my information, is a good conversation to have as well. And with that, I want to thank Ms. Geurts for joining us today. We appreciate you taking the time to talk to us on this really important topic.
Happy to do so. Thank you.
If we did not get to your question, please feel free to drop an email to conversations@mcw.edu. I hope you all join us next month for a virtual coffee break and a conversation with a scientist.